Distinguished guests, ladies and gentlemen, good afternoon. First, let me say I cannot promise that my presentation will be as inspirational and uplifting as that of Belinda. I'm sure you'll forgive me for that. Now, in my presentation, I propose to present a view of the finances of the district, and that's one possible view of the district. We'll look at the results and the financial position for the local health district, South Western Sydney local health district, for the financial year ended 30th of June 2013. But I thought to put a sense of perspective on the numbers that I'm going to be quoting you, I thought to myself, what is the district? And I'm not sure you're all familiar with it. I've been here for 3 years now and I'm still learning what South Western Sydney Local Health District is all about. So to put it in perspective, there are 15 LHDs across the state and 2 specialty networks. We rank ourselves with the other, with a total of 15. We look at total expenditure, the total expenditure on our services for the year. We look at total assets employed and total employees. We rank in the top 5 of the 15 LHDs across New South Wales. So we're quite substantial in size and ever growing. If we look at activity levels, I would expect that our ranking would even be higher than that. And then we turn to what is the LHD? What do we do? There's the obvious things, the 6 hospitals we run: Bankstown, Barrel, Camden, Campbelltown, Fairfield and Liverpool. I remember them all. There's 21 community health centres where we take our services out into the community. There's a number of specialty services that I'm still getting my mind around: community health, population health, drug health, dental health, mental health. A vast variety of services like that. There's also the important activity we carry out in the form of training and research that we do in conjunction with the Uni of New South Wales, Uni of Western Sydney, and the Ingham Institute for Applied Medical Research. Very important parts of our operations. And then there's the part of our operations that some of you may not be aware of, is that the affiliated health organisations we work with, there's 5 of them. I'll try to remember most of them, but we have things like SCARA, which is the Benevolent Society. We have the STARS program. We have Carrington House. What's the other one? I'd like to get something. Sorry? Caratone, of course. And then we have Brayside, which is operated by Camden Care, and that's out at Fairfield. So that just gives you an idea of what our LHD is about, and I'm sure I've missed something. So when I'm quoting the numbers, just bear in mind that that's what it represents. Now, the financial statements that I'm quoting from, those prepared by Greg's team, and for the year ended 3rd of June 2013, as I said, they're very important. They're only a financial view. They can't hope to measure the contribution that this district is making to our communities. But it's a financial measure, and it's a very important part of our accountability to the Ministry of Health, to the New South Wales Government, and to the people of New South Wales. So that's the big picture. Okay, the numbers. This is our 2nd full year as a health district. You remember we formed a couple of years back as a new LHD when we split off from the old Sydney LHD. So we've been going 2 full years now. So on occasion, when I quote some of these numbers, I'll quote you what it was last year. You get a bit of an idea on how much we've changed since then. Okay, so turning firstly to our operating result. That's our profit and loss, if you like. The operating results for not-for-profits, we tend to focus on expenditure. The expenditure we have to incur to provide the services that we provide. We look at expenditure first, and then we look at revenue to see how we finance that expenditure. So total expenditure for the June 2013 year was close enough to 1.4 billion, and that's up a bit from, what was it last year? 1.337 billion last year. So expenditure continues to grow as our level of activity grows. So just looking at a few elements, and I'm not expecting you to remember these numbers, some of you have made, but it just gives you a sense of what's happening during the year. And I might emphasise that if you are really excited by finance and you would like further detail on these numbers, you can look at the Ministry of Health website and our financial statements are there. But I'll just continue. The biggest expenditure item, you wouldn't be surprised to know, is employee expenses. That's $878 million, and that is up from last year, and the number last year was 851 million. That covers things like wages, salaries, on costs, long service leave, annual leave, sick leave. It also covers certain agency staff when we need to hire those to make up the numbers. Last year at 30th of June we had 8,881 staff or thereabouts, and that number is up again on what it was for the same period last year. But I hasten to add that those staff numbers and that expenditure doesn't include the efforts of our carers and the efforts of our many volunteers who make a significant impact on the services of this district and all other districts for that matter. So I think that should be recognised. We just can't measure the contribution that those people make. Other expenses, VMOs, our visiting medical officers, are a very important part of our health system. 45 million last year, 45 million this year, much the same number. Drugs, medical and surgical supplies, you wouldn't be surprised, they're the sorts of things we consume in providing our health service. 137 million this year, last year 132. Depreciation, I might explain that. That's something the accountants dreamed up to try and measure the cost of the assets we're using up in providing the health service. This building we're sitting in, the hospitals, the medical equipment, the vehicles, the car parks, everything we use has a finite life. It can be a physical life, it just wears out physically. It can be technological, and that's more important. The latest piece of medical gear, which is cutting edge now, in 5 years' time might be obsolete. We have to throw it out. So what we attempt to do as accountants is spread the cost of those assets over their useful life, and that's what we call depreciation. So for last year, depreciation was $52 million charge, compared to the previous year, 41. And that reflects the growth in our asset base, and I'll cover that briefly when we turn to the balance sheet. So that just gives you a bit of an idea on the expense side. The revenue side, where we get the money to run this business, well, not surprisingly, because we're a public sector organisation, we get funded by the New South Wales Government, the Treasury, and directly by the Ministry of Health. And our funding allocation last year was 1.179 billion, and that's up from 1.084 billion in the previous year. So that's really where most of our funds come from. But just a couple of others I'll mention. Patient fees, 51 million. You might say, what's so great about that? Well, last year that number was 44 million. And that's extremely important because that's revenue we get from outside the system, mainly for private patients who are using their private health care. And that's been a focus of the management team and staff to generate more revenue by encouraging people to use their private health cover. So that shows the efforts they've made, and it's an extremely important contribution. Department of Vet Affairs, 24 million this year, and last year that's contribution from the Commonwealth Government for us to provide services to veterans. And lucky last is high cost drugs funding, another one from the federal government, I think, 21 million for certain specialised high cost drugs. So just a snapshot of some of the revenue and expense items. What does all this mean? The most significant indicator for us is whether we actually achieve our budget. At the beginning of the year, we get allocated a budget by the ministry, and we are judged on our ability to meet that budget. So last year, despite a very, very stressful year, I might say, operationally and financially, we came within $2.5 million of our budget. So $2.5 million in $1.4 billion, I think is a very good result, and I think we should be very, very happy with that, particularly in the context of many LHDs, other LHDs struggling and running out of their budget. So I think that is a compliment to the entire team in the district, the efforts they put in to provide a high quality health service and still keep our budget. And you might say, why don't we increase the budget? Well, that would be nice. The New South Wales Government has a problem, the Ministry of Health has a problem, the Australian Government has a problem. For that matter, most other governments overseas have a problem. So I think we have to accept that we have to live responsibly within the budget we're allocated, and I think we've done that last year. It's a great effort. I'll just turn briefly now to the balance sheet. The balance sheet, if you like, is the assets we're using and the liabilities we incur in operating our business. And don't worry, I won't run through the whole thing, but I just thought it's relevant for you to get an idea of what we're using to run this business. Property, plant and equipment is probably the most significant asset group. That's the buildings we're sitting in, the plant and equipment we use, the lifts, the equipment we use in the operating theatres, the beds, as I said before, car parks, the land we sit upon. All those assets we need to run a health service. And the total value of those assets this year, 30th of June, was $1,186 million. That's up about $130 million from the same figure last year. Now, included in that, there was a revaluation, which is account speed for moving the value of the assets up to reflect current market values. But more importantly, it also reflects the continued growth in our asset base. The work that's going on down at Campbelltown, $130 million project to expand Campbelltown, that growth in those numbers is in there. And that will begin again next year when the project's nearing completion. It includes the work here at Liverpool on the subacute mental health unit, which was completed this year. And it also includes the expenditure on the Nurses Education Centre, which is going up across the line here on Euston campus. So it just reflects the fact that our asset base is growing and we continue to need capital funding in addition to revenue funding to keep this business going. So what's the bottom line? Well, the bottom line is we have more assets than liabilities. So we add up all of our assets, take off all of our liabilities. Now, liabilities include things like trade creditors, the people we purchase things from. They include funds that we owe our employees in due course, annual leave, long service leave, those things. When we take one off the other, we end up with net assets at June $1 billion, and that compares to $893 million in the previous year. So the good news is, if we're a commercial business, we've increased our assets and we're worth $1 billion. But the most important thing is that we have those assets to put to use to serve our community. I might just mention the audit process because I said the financial statements that I've drawn my numbers from are part of our accountability. And part of that accountability is having an audit. Those financial statements are reviewed by the audit committee, they're then reviewed by the finance committee, and then passed on to the board, and then eventually Amanda and Greg sign them off on behalf of the district. Through all that review process, I think we found that the quality of statements was very good. There were very few issues, and I'd like to compliment Greg and his team for that effort, again under very stressful conditions and with a tightened timetable. The external audit is performed by the Audit Office of New South Wales on behalf of the New South Wales Government. They review the accounts and they give us an audit report. I'm pleased to say that audit report is unmodified, which for normal folks mean that there was no qualification in it, it was a clean report and it's good news. So I think that's a fantastic result for the year. The accounts have been done, they've been signed off, they've been lodged on time, and there were no qualifications. So we should be very happy with that. Phil mentioned that I'm chair of the finance committee. I'm one of 4 directors on that finance committee. The others are all here today as well. Nina Berry over here, Carolyn Burley over here, and Professor Milner over here. I'd like to thank them. I'd also like to thank the management team and the board for their support in the operations of the finance committee. And its role is really to provide financial governance and oversight on behalf of the board for the year. So that's all I have to say, Mr. Chair, and thank you.